Do you feel ignited about the Tree Center? Yes, we all do. So my name is Francisco Ronquillo. I'm a health extension officer with the Office for Community Health, and I'm also a Hispano Latino health specialist. My work is in the community, looking at what are the issues affecting our community, how is it that we can really tackle them so that we could have more success in improving the health outcome and decreasing the health inequities that exist. My pleasure and my mantra and my principle working in the community is people don't care how much you know until they know how much you care. When you're there from the heart, giving your best to really look at what's affecting your community, then that's when we're gonna make change. The Tree Center, the focus is gonna be mental and behavioral health. That's an extremely important issue. Why? Because we need to look at what is happening, what's the composition, and most importantly, how can we change it? I don't know if you believe in the same concept that I do, but I think New Mexico, because it's the rising majority state in the nation, because of our population, because of the Native Americans that are here and have been here for many, many generations, the Latinos, right, the African Americans, we can make a difference. And there's a need to grow our own. So if we think, why do we need to grow our own? Because there's a lot of issues affecting and afflicting our communities. So when we think, the social determinants of health that we always talk, it's those social forces that are affecting our communities. Poverty, unemployment, food insecurity. That's why we need to make a difference. But there's hope. Why? Because my brother Ryan, my sister Key, my sister Evelyn, they told you how resilient we have been, right? And how we have grown. Just to illustrate what's happening nationally, not only in the state of New Mexico, there's an exponential growth of Latinos, and eventually there's gonna be more people of color, 58 million by the year 2016. We're the principal driver of the demographics. We're gonna contribute so much to the economy that we are gonna make a difference. And I'm speaking for the Latinos, but this is, if we look at the issues, it really affects every single people of color. And I'll tell you, how are we gonna deal with this? I remember my grandma, get depression, get up and sweep, right? Because she said, you need to work, get depression. Why? Because our population is not used to that. We come from remote communities, we come from poverty, where access to services are limited, and sometimes you don't even hear about mental behavioral health. Yet in medicine, we see it, right? A chronic condition along with a mental condition, right? A person that's diabetic and also depressed. The other thing is, yo no estoy loco. These are important concepts that we need to think about because our community, many people think, I'm not gonna go share my problems con una persona que ni me conoce, somebody that doesn't even know me, right? And I'm not crazy. Why am I gonna talk to a person? So the other thing is to consider with a Latino population, this is a famous dicho, la ropa sucia se lava en casa. What does that mean? That we're very private. See, we don't want people to know our things. You're a diabetic in the family and you think nobody knows, but everybody already knows that you're a diabetic, right? But we're thinking of that privacy thing. The other issue that has been compounding for many, many generations is the lack of language in terms of providers that are giving the service in medicine and mental health that cannot speak the language. When you go to the room, como llamarse tú, right? And then who's helping there? The little ones are assisting with interpreting, right? Those are the issues that we need to really look at. How can we change this so that we could really serve our population? Seguro? Insurance? What's that? In the Latino community, many people are not, especially the immigrant community that comes from other countries, they're not used to paying, insurance. So when they hear premiums and, deductibles, it's like, what's that? See, it doesn't make sense to a lot of our people. So we need to be cognizant of that and how are we gonna build capacity. The other thing, immediate and extended family. And that's very typical of all our people of color, right? In the Native community and the African American community, my issue is not only my issue, it's a family affair. Because you know what, maybe I'm gonna end up paying that bill too. So I need to know what's going on with grandma, see? I remember when I was training as a physician assistant and I was doing my surgery rotation and it was packed with a lot of people and the surgeon said, oh my God, why are there like 20 people in there? Because we're Latinos, see? And everybody has to be here because we don't know what's gonna happen to dad. We don't know what's gonna happen to grandma. The other thing is, dile que te dio diabetes por susto. The other thing, the beliefs that we have in terms of our culture and how susto can impact diabetes or other conditions. And the other thing is traditional medicine. That's another important thing that we have seen in our Native Americans, in our Mexican natives, right? In terms of those cultural, traditional practices that have been going on for many, many generations, there's a lot of wisdom and there's a lot of knowledge. How do we integrate Western medicine, allopathic medicine, with traditional medicine to be more successful and really be able to offer things, a variety of things that our population in New Mexico and around the country will need? And finally, espiritualidad. New Mexico, because of our populations, again, the Native American communities, the African American communities, the Latino communities, we are people of faith, right? When it comes to psychology, psychiatry, counseling, many times the pill is not gonna work. Talking to somebody is not gonna work, but maybe going to a spiritual guide is going to work. Maybe praying to the Virgencita de Guadalupe is going to make my grandma feel better. Finally, I just wanna say there's an important, urgent call to action. We need to grow our own. Do you agree with me? Yes. I am not convinced. Do you agree with me that we need to grow our own? Yes. That's why we're here. Through the Tree Center, we're gonna make a lot of good things happen for New Mexico and New Mexicans. So I just wanna mention why. Los bullets, por favor. Thank you. El talento está aquí. There's a lot of people, and I came from Southern New Mexico, and I know that probably 98% of my friends were bilingual and bicultural. Imagine that. So we need to be more astute in terms of how are we recruiting the people that need to be here. How are we, and thinking of, for example, public health. No offense, I was an employee of public health. But the people in the front look like the people that they're serving. The people in the back do not. How can we start moving that so that the people in the front can become the future nurses, PAs, physicians, etc. Counselors, psychologists, psychiatrists. They are here. The other thing is we have an amazing group that I'm very proud of. Dr. Kokari Stone and many others here in the room are part of the Chile, the Collaborative for Hispano-Latino Health Equity, where we're looking at these are first generation graduates. We're talking about MDs, PhDs, PAs, people that already went through all those hoops. We are here to support the younger generation because we've been through it. We know what it feels like. We know what the challenges are, but you know what? You are not alone. We are here to help you. The other thing is there's a lot of young people with strive and with ganas. They want to succeed. We need to look at equity. What are we doing in terms of equity to really bring equitable opportunities? It's easier for a kid in high school to get a joint 3 blocks from the school than to get a scholarship. How can we change that so that we can make it more equitable and have more opportunities for our young people? The time is now. Join us, become part of the solution, porque el futuro está aquí. The future is here and it's you. Gracias.